Welcome, everyone. Thank you for attending the Health Promotion and Chronic Disease Prevention 2017 through 2025 Strategic Plan Share Out webinar. My name is Lucy, and I'm the Manager for State Policy Systems and Environmental Change for the Health Promotion and Chronic Disease Prevention section at the Oregon Health Authority Public Health Division. Today, I'm serving as MC for this webinar. Before we get started, I want to share a few housekeeping items. First of all phone lines will be muted for the presentation. This reduces the amount of distracting background noise and will help everyone hear those who are sharing. If you have a question during the presentation, please type it into the chat box. We will be monitoring the chat box during the presentation and will address questions throughout as appropriate. Second, we will answer questions during the discussion portion of the webinar. Phone lines will remain muted, but if you have a question, please use the raise your hand function to signal that you would like to ask a question. We'll unmute your phone line so that you can submit your question via the chat box as well. If you ask a question over the phone, please say your name and where you're from. For example, like, this is Lucy from HipCDIP. Before asking your question, sharing feedback or comments, this will help everyone know who is speaking, and so they can all follow along in the conversation. Finally, this webinar will be recorded for the purpose of ongoing learning and sharing, and it will be made publicly available on the HipCDIP Connection website. We will share the recording link with grantees and partners through our listserv. So to get us started, I have a poll question for you. It's an easy poll question. Does your organization have a strategic plan that guides your work? So take a moment and respond to that poll, and we'll discuss those results. All right, you're getting lots of great participation. Thanks for those of you that jumped in early. You still have an opportunity to participate. And we'll go ahead and close the poll now. It looks like our results show that about three-quarters of us use a strategic plan or have a strategic plan that guides our work, and about a quarter of you indicate that you do not. So I'm hoping that the fact that some of you have a strategic plan gives you an opportunity to see how that connects with what we're going to be presenting today as a strategic plan. And if you don't have a strategic plan that guides your work, perhaps the information that we're sharing can help you either inform a strategic plan or guide your work that is in common with ours. All right. So moving along, during today's webinar, we're going to talk about 4 key things, and they include why did we create a strategic plan, how was that strategic plan developed, what's in our strategic plan, and we're going to have time, of course, for questions and discussion. So I invite you to think about during today's webinar, what are the components of our strategic plan that align with your work? Do you see some opportunities to collaborate on some shared initiatives or goals? And are there opportunities that you see that your organization can provide leadership and help us move along on those objectives? All right. Throughout today's webinar, you'll hear from many health promotion and chronic disease prevention section staff members, including managers, program staff, policy analysts, and data analysts. Our team is integrated across capabilities, and we coordinate closely across areas of expertise. So to get us started today, I'm very pleased to introduce Karen Gerard, the Health Promotion and Chronic Disease Prevention Section Manager. Karen will share why we created a strategic plan and will outline the strategic plan goals.
Thank you, Lucy. I'm really excited to share out the 2017-2025 strategic plan with you today. Reducing chronic disease in a state of 4.2 million people is really hard work. Getting it done takes many people and partners throughout Oregon, chipping away at challenges every day. I like strategic plans because they keep a complex organization like ours focused only on the work that will get us closer to our goals. A strategic plan helps us mark our progress and improve our methods as we go along. It also helps us to say no to efforts that may detract from our mission. And here at the Health Promotion and Chronic Disease Prevention section, our plans deliver results that matter. We acknowledge that improving health for all Oregonians, especially those who have historically been discriminated against or marginalized, is a very big task. Today in Oregon, fundamental components of health such as nutritious food, space to play and be active, and smoke-free places are out of reach for far too many people. At the same time, Oregonians in too many communities are surrounded by products that are harmful to their health, from tobacco and e-cigarettes to alcohol to sugary drinks, and are targeted by excessive advertising and marketing messages that promote unhealthy options. When people don't have access to fundamental components of health and are surrounded by unhealthy products and marketing messages, they are at greater risk for developing a chronic disease. 4 out of 5 Oregon adults have a risk factor that could lead to chronic diseases such as cancer, heart disease, diabetes, addiction, or arthritis. With a ratio like that, it's clear we have a systemic battle on our hands. We won't improve the health of our state simply by urging individuals to make healthier choices. Instead, our strategies aim to reduce these risk factors with actions at the community level that increase Oregonians' access to the options they need to live healthful lives and to decrease the availability and excessive marketing of harmful products. When Oregonians in every part of the state have more opportunities to choose healthful options and face less exposure to harmful products and excessive marketing, more people will be able to live tobacco-free, eat better, move more, drink less alcohol, and better manage their own health. Like the Healthy Places, Healthy Peoples framework illustrates here, everyone in government, public health, health systems, businesses, local communities has a role to play in improving health in this state. We call on all Oregonians to seize their roles in this endeavor. As a result, Oregon will be a more healthful place to live, work, learn, play, and age for all of us. The Health Promotion and Chronic Disease Prevention Section's strategic plan was designed to help us talk with tribes, communities, and other partners, all of you, about why we have chosen our specific goals and the steps that we can all take together in every Oregon community to achieve better health for all. Working together, we can focus resources on evidence-based strategies that have been proven to improve health for everyone. It is my hope that you will leave today's webinar with a clearer understanding of the Health Promotion and Chronic Disease Prevention section's goals and objectives. But more than this, I hope you leave today with a clearer understanding on where your work aligns with ours. It is in this overlap that we can collaborate and coordinate and ultimately maximize our collective efforts to improve health for everyone in our state, communities, neighborhoods, families, and even for ourselves. So why did we create a strategic plan? The 2017-2025 strategic plan was created to establish clear goals, strategies, and objectives to reduce chronic disease and the burden it places on people, communities, and the economy. In a complex organization like ours, staying focused on the work that gets us closer to our goals is challenging. The strategic plan reminds us of the bigger picture when we get discouraged, and it keeps us from getting distracted by day-to-day activities. Specifically, this plan demonstrates the state's role in reducing tobacco use, reducing excessive alcohol use, increasing physical activity, and limiting poor nutrition in our state. As our plan illustrates in detail, some obstacles to a healthy life are baked into our society. These barriers are much higher for some communities than others, leaving certain populations in Oregon much worse off. The Health Promotion and Chronic Disease Prevention section's goals and objectives focus on increasing the opportunities for all Oregonians, no matter who they are or where they reside in our state, to be healthful in the communities where they live, work, learn, play, and age. Many of the leading causes of death in Oregon are due to chronic diseases. 1 in 2 adults in Oregon live with at least one chronic disease, and chronic diseases account for 4 of the top 5 leading causes of death. cancer, heart disease, chronic lower respiratory disease, and stroke, and the other leading cause is unintentional injuries. Some risk factors, like age and genes, we can't change, but others we can. By decreasing these risk factors for chronic disease, we can make Oregon a healthier place. The leading risk factors which can be changed and that increase a person's chances of developing one or more chronic diseases include tobacco use, physical inactivity, poor nutrition, and excessive alcohol use. I want to pause here and say that throughout this webinar, as well as in the strategic plan, when we use the word tobacco, we are referring to commercial tobacco, unless otherwise noted. Similarly, as used in the webinar and in the strategic plan, obesity refers to the medical condition or disease that causes or complicates multiple chronic diseases, including diabetes, heart disease, and cancer. Blaming individuals who live with obesity and the other risk factors does nothing to improve their health or the health of our communities. In fact, bias and stigma can heighten or even create mental health issues. The focus of public health and of this strategic plan is on improving our physical and social environments in ways that help all Oregonians live healthful lives. A person with one risk factor, for example, someone who doesn't get enough physical activity, faces a higher risk for developing a long-term, life-shortening chronic disease. As a person's risk factors multiply, their chances of developing one or more chronic diseases also increases. In other words, smoking cigarettes is bad for your health. Smoking cigarettes, drinking too much soda, and not moving enough during the day is worse. Many people in Oregon have one or more risk factors for chronic disease. In fact, 4 in 5 Oregon adults have a health risk factor which can cause or complicate chronic diseases, such as high blood pressure or cholesterol, current cigarette smoking, smokeless tobacco use, obesity, binge drinking, or physical inactivity. Having obesity is a leading risk factor affecting more than 900,000 or 29% of Oregon adults. Yet, when we help Oregonians eat better, move more, live tobacco-free, and drink less alcohol, we help reduce the burden of chronic disease in Oregon. And this means preventing chronic diseases, managing existing chronic conditions, lowering the financial costs of chronic disease to individuals, families, and our state, and improving the day-to-day experience of people living with chronic disease. In summary, the leading risk factors that increase a person's chances of developing one or more chronic diseases are tobacco use, physical inactivity, poor nutrition, and excessive alcohol use. By decreasing these risk factors for chronic disease, together we can make Oregon a healthier place for everyone. This is why the Health Promotion and Chronic Disease Prevention section chose to focus on these 4 areas of our strategic plan. With limited resources, staff time, and funding, as well as a patchwork of organizations and systems, it is important to stay focused on the work that will get us closer to our goals. Now, Megan Gertis, who serves as a health promotion strategist, will share with us how the strategic plan was developed and written.
Hi, thank you, Karen. The 2017 to 2025 strategic plan builds on more than 10 years of prevention experience with state and local partners. As a result of previous health promotion and chronic disease prevention strategic plans, Oregon communities have grown measurably healthier. For example, we have reduced tobacco use among adults and youth, the leading cause of preventable death in Oregon. We have also increased the percentage of Oregon adults who have been screened for colorectal cancer, the second deadliest cancer, but one that can be prevented through regular screening. The 2017 to 2025 strategic plan priority areas were developed through the analysis of the data Karen just shared. We built this plan on the leading causes of preventable death and identification of the leading risk factors for chronic disease. The goals and objectives were developed based on an analysis of health outcomes across the population in Oregon. And in alignment with other statewide initiatives. Once the priority area goals and objectives were developed, we began writing the narrative report to memorialize our commitment to do this work, as well as to create a tool that could be shared with funders, partners, and grantees. The strategic plan guides coordinated state and community efforts, including alignment with the State Health Improvement Plan, alignment with public health modernization, and alignment with health systems transformation. Now, Ashley Thurstrup, the Manager of Community Policy, Systems, and Environmental Change, will share how HIPCDIP considered health equity implications throughout the plan and incorporated feedback from regional health equity coalitions, which shaped the strategic plan narrative.
Thanks, Megan. I'm going to start just by kind of framing this based on reality here in Oregon. One thing we know for sure is that not all places are created equal. This is by design. The level of public investment in the places that we live, work, and play, and all of these conditions together can make it easier or harder to prevent or manage chronic diseases and take charge of our own health. Certain populations in Oregon do bear a greater burden of chronic disease than others. And simply put, they live sicker and they die younger. This is unfair, and we call these differences health disparities. So health disparities are fueled not only by the differences that exist in the physical places, such as our homes and our schools and our neighborhoods and our workplaces, but also by the social conditions that shape our lives, like different education and income levels, incarceration rates, or the discrimination and racism that we do or we don't encounter in life. Therefore, to really achieve our mission to reduce chronic disease in Oregon, we need to identify which communities are worse off in terms of health and then put in place strategies that will produce the greatest health benefits for them. We need to change the systems and structures throughout our state and communities in ways that expand people's access to healthy options and increase the amount of places and environments that support good health, while also working to counter structural racism and center people and groups who have historically been left out of policy and systems change efforts. When developing our strategic plan, we recognize the importance of ensuring that our language throughout the plan really resonated with those who are most impacted by chronic disease in our state. So we reached out early in the process to Regional Health Equity Coalition grantees to engage them in gathering input from community members about language, about framing, about how the actual strategies resonated and intersected with their community priorities. The Regional Health Equity Coalitions are collaborative, community-driven, cross-sector groups organized regionally, usually in one or two counties. Sometimes they're working in a tri-county area. And they work to identify policy systems and environmental solutions that increase health equity for underserved and underrepresented communities experiencing some of those health disparities that I talked about. They assess community needs, engage policymakers, and support efforts to increase and authentically involve their community members who might be experiencing these health inequities in the local and state policy and systems change initiatives that are happening in their communities. REC efforts increase awareness of social and cultural differences, challenges facing specific populations, including the harms of unfair, predatory tobacco industry, alcohol industry, and sugary beverage industry practices. They help elevate the importance of comprehensive policies within a racial justice lens. When developing policy and programs together in a process of co-production at the local level, at the state level, we can create sustainable partnerships and urgency in communities experiencing the burden of disease in Oregon. So here you see a map of the funded regional health equity coalitions in the 2017-19 timeframe that work together with us to act as a community voice and community convener for providing the input into the implementation of our strategic plan and the development of our language. The regional health equity coalitions that were involved in this were the Southern Oregon Health Equity Alliance, the Mid-Columbia Health Equity Alliance, the Lynn-Benton Health Equity Alliance, Oregon Health Equity Alliance, Let's Talk Diversity Regional Health Equity Coalition,
and the Klamath Regional Health Equity Coalition. Although we didn't have a Regional Health Equity Coalition located in Eastern Oregon, as you can see in this map, we are really glad to be talking with you today to hear how these strategies and goals might resonate with the work that you're doing in your communities, and we're really interested in continuing this conversation. The Regional Health Equity Coalition feedback overall guided our language, our framing, and provided that really important, rich history and information about how the health equity implications really play out throughout the strategic plan. So you'll see that throughout the language. Throughout the process, we also emphasized a focus on learning together with our Regional Health Equity Coalition partners. And we're still doing that today. We're still thinking about what we've learned throughout this process and engaging with them on what we can do to move these strategies forward in a way that's really grounded with what communities are telling us that they need. In every facet of the plan, you'll see that we seek to address health disparities in Oregon and the inequities that fuel them. So next, I'm going to transition to Lucy to introduce what is in the strategic plan.
Thanks, Ashley. Hi, everyone. It's Lucy again. The 2017 through 2025 strategic plan demonstrates how the health promotion and chronic disease prevention section is going to build upon our past achievements. In it, we describe how working together with tribes and communities will further increase the opportunities for all Oregonians, no matter where they live in the state, to eat better, move more, live tobacco-free, drink less alcohol, and take charge of their own health. For each of the 4 risk factors we selected, this plan identifies the disparities that exist among different populations in Oregon, strategies to reduce the inequities that fuel those disparities, and the measurable objectives that will support each strategy and reduce chronic disease in Oregon by 2025. So here you see the 4 goal areas. They include tobacco use, with the goal of decreasing cigarette smoking among youth and adults and decreasing annual per capita cigarette sales. Risk factors related to reducing obesity among youth and adults, which include physical activity, with the goal of decreasing the percentage of youth and adults who engage in little to no physical activity, and poor nutrition, with the goal of reducing the percentage of people who consume 7 or more sugary drinks each week. Another goal is excessive alcohol consumption, with the goal of decreasing heavy and binge drinking among youth and adults and decreasing the total per capita alcohol consumption. So our strategies aim to reduce these risk factors in 2 ways. The up arrow describes how we will do this by increasing access to options that Oregonians need to live healthful lives, and the down arrow showing the importance of decreasing the availability and excessive marketing of harmful products. So increasing access to healthy options is very important, and we also need to decrease the availability of harmful products. Our programs operate amongst a vast sea of industry influence in our communities. For example, the tobacco industry spends more than $100 million per year in Oregon to market and advertise its products. 90% of it is spent in stores. This is about 10 times more than the annual tobacco prevention and education budget. So you can see that in order for our efforts to be successful, we have to address industry marketing tactics. You're going to see some common threads across our different goal areas. These cost-cutting approaches include addressing the places, price, offering protection, and addressing access. Now I'll turn it over to our policy specialists to talk about the strategic objectives for tobacco, physical activity, nutrition, and excessive alcohol use in more detail. We'll start with Amanda.
All right. Thanks so much, Lucy. I guess I can say good morning to everybody on the line. Thanks for being with us. My name's Amanda Q. I'm an alcohol and other drug policy specialist with the Oregon Health Authority. And before we dive into this goal area in our strategic plan, I have a poll question for everybody on the line. So, question is, when was the beer tax last raised in Oregon? Everybody get in their answers: 2009, 1994, 1986, or 1977. Great, I'm seeing responses coming in over the poll. I'll give it a couple more seconds. Okay, poll is closed. Let's see. It looks like, here we go. Everybody should be able to see this on the screen. Congratulations, the majority of you indicated 1977. About 36% of you indicated that this was the last time the beer tax was raised in Oregon. Some other good guesses out there, but that's over 40 years ago. A significant amount of time. As stated in the last slide that Lucy talked about, price is a common strategy in our strategic plan, and the role of price on products can play an extremely important role in reducing excessive drinking and its related harms. So we'll get back to this pricing piece in just a moment, but thanks for taking a guess on the beer tax. Before diving into the goal area strategies, I think it's important for us to have a common understanding around what excessive alcohol use is. Excessive alcohol use is not limited to people who are addicted or who may have a dependence on alcohol. Excessive alcohol use includes binge drinking, heavy drinking, underage drinking, and any drinking by pregnant women. In fact, I think it's important also to know that binge drinking is the most common and most dangerous pattern of excessive alcohol use. It's responsible for half the deaths and 3/4 of the economic costs associated with excessive alcohol use. We know that binge drinking among Oregon youth has decreased since 2001. However, binge drinking among young adults remains high and continues to trend upwards for all adults across the lifespan over the last 15 years. I do want to point out that, again, the reducing excessive alcohol use is a risk factor that we are focused on here, and addiction is one of the chronic diseases that we are focused on within our strategic plan. Again, to continue from last slide, excessive drinking we know has serious consequences for public health. The impacts on not only individuals, families, and communities, as well as the harms and the costs associated with substance use and abuse are widespread. It's the third leading cause of preventable death in Oregon. It's responsible for nearly 2,000 deaths each year and costs the state over $3.5 billion annually. That's billion with a B. Excessive alcohol use can lead to liver disease, diabetes, cancer, alcohol dependence or addiction, and injuries. However, conversely, consuming less alcohol lowers a person's risk for injuries and for developing a chronic disease. Drinking less alcohol also helps people manage existing chronic diseases, including liver disease, cancers, and alcohol dependence. So in sum, our strategic plan focuses on building support for policies and environments that discourage excessive alcohol use and prevent alcohol-related harms in Oregon communities, and strengthen community environments that are supportive of those in recovery. So when taking a look at the specific objectives to reduce excessive alcohol use, a combination of efforts can make a significant difference in this body of work. Reducing the burden of binge drinking and heavy drinking through multiple evidence-based strategies will improve health in Oregon communities and lower healthcare costs. If you recall, again, that price, place, protection, and access themes across our strategic plan, these strategies focus on increasing the price of alcohol products, reducing availability of alcohol and exposure to alcohol marketing and promotion, as well as working closely with our health systems to ensure access and screening and referral services. To quickly take a look at these objectives, increasing the price of alcohol reduces use among youth, adults, and alcohol-related problems, including alcohol-impaired driving among adults. When revenue from these alcohol prices, like taxes, are then dedicated to comprehensive prevention and education programs, it only amplifies these outcomes. For number 2 and 3 up here, we know that this is place. Focusing on certain alcohol retail restrictions can also reduce alcohol-related problems such as violence, crime, injuries from motor vehicle crashes. Strong evidence tells us that the higher density of places that sell alcohol is associated with an increase in these problems. We also know that community environments that reduce alcohol availability and exposure to marketing and promotion discourages use. Alcohol restrictions here can occur at the state level, in cities and jurisdictions, counties, as well as in colleges or universities. For number 4, this is around our health system partnership. Specifically, coordinated care organizations in Oregon can play an important role in helping reduce excessive alcohol use through accurate assessment of its plan's member excessive drinking status, expanding coverage, and ensuring access to screening, referral, and treatment services and benefits. And lastly, in Oregon, the state controls the sale of distilled spirits. In other words, this means the state acts as the wholesaler for distilled spirits and controls the price and generates revenue for the state from the sale of distilled spirits. The evidence recommends against further privatization of alcohol retail sales, which would result in increases in per capita alcohol consumption. When alcohol retail markets are privatized, or in other words, loss of control, the availability increases through increased outlets and lower prices. So just a quick moment, how are these objectives put into action? What does that look like in communities at the state and local programs? These are just a few programs, these are just a few examples that focus on, again, price, that place of the retail environment, and working with our health system partners to inform, educate, and empower people about substance use and abuse. Real quickly, OHA proposed a legislative concept to increase the price of alcohol in 2018. OHA also conducted a tobacco and alcohol retail assessment, building community capacity to look at the alcohol retail environment and how pro-alcohol marketing builds capacity. Pro-alcohol marketing influences communities and builds capacity for communities to have conversation about the role of alcohol in their community and opportunities to address it through outlet density work. The assessment exposed the ways in which the alcohol industry targets Oregonians, particularly young people, through flavor offerings and low prices. And again, it provides a foundation to discuss how communities can take steps to limit access to alcohol by young people, reduce excessive drinking by changing the rules for where and when alcohol can be sold. Again, with our health systems work, this focuses on promoting health system changes to remove barriers to accessing and completing services and creating incentives for our health systems to provide needed services, such as the screening, brief intervention, and referral to treatment incentive metric. This wraps up the excessive alcohol use goal area portion of our strategic plan. I look forward to future conversations around this goal area, but I'm going to now pass it to Steve White, who's going to talk with you all about physical activity as a risk factor for obesity.
Great, thank you so much, Amanda. So again, I'm Steve White. I'm a policy specialist here in the Health Promotion and Chronic Disease Prevention section, and I have the privilege of providing an overview of our efforts to increase physical activity in Oregon. To get us thinking about physical activity, we've got a polling question for you. Question, would you walk, bike, or take transit more often if it was safe and convenient to do so? So take a minute to record your answer there and we'll see what we get. All right, they're coming in. Excellent. All right, and it looks like almost 9 in 10 of you out there said yes. So For those of you who answered yes, you're not alone. Walking in particular is an activity that most people would like to do more of and is one of the easiest types of physical activity for people to integrate into their daily lives, if, of course, it is safe and convenient. We'll discuss this in more detail in a minute, but making it easier for people to walk is one of our key strategies for helping people in Oregon be more active. So, why do we focus on physical activity? As Karen mentioned earlier, physical inactivity and poor nutrition are the major drivers of obesity, a condition which increases a person's risk of developing diabetes, heart disease, stroke, arthritis, cancer, and other chronic diseases. And as a lot of us know from our daily lives, the places we live, work, learn, play, and age often determine whether or not safe options to walk and be physically active are even available to us. Unfortunately, most people in Oregon don't get enough physical activity, including the 20% of all Oregon adults who get no physical activity at all. This is not by choice. Most people would like to be more active and make physical activity a part of their daily lives, but face barriers that make it difficult to be physically active. To help address these issues, our strategic plan focuses on improving our physical and social environments in ways that help all Oregonians maintain a healthy weight and live healthful lives by making physical activity a part of their regular routines. In order to help all people in Oregon become more physically active, we focus on addressing the needs of people who face greater challenges to being physically active because of social or environmental conditions or existing health conditions. Some of these challenges include living in neighborhoods that lack basic infrastructure for physical activities, such as sidewalks and trails, or living with chronic health conditions such as arthritis or obesity that can make physical activity difficult without additional education, encouragement, and support. When we address the needs of people who face additional barriers, we not only improve equity and reduce disparities, but also make it easier for all people in Oregon to make physical activity a regular part of their daily lives. Our plan contains 3 strategies for increasing physical activity. The first is to expand the availability, safety, convenience, and appeal of places for people to be physically active, with priority on helping people who are physically inactive becoming more active by walking or rolling. Our focus on walking stems from the fact that walking is not only the most common form of exercise, but it is also the easiest form of exercise for most people to integrate into their daily routines. I'll provide a couple of examples of our work in this area in a minute. Our second strategy is also place-based, but focuses on work sites. This strategy is to increase the number of work sites in state and local agencies, hospitals, coordinated care organizations, and schools that adopt strategies for changing policies, systems, and environments in ways that will increase physical activity, especially among people who are physically inactive. Much of this work is currently focused on supporting the implementation of Governor Brown's executive order on state agency employee wellness, which requires all state agencies to develop and implement employee wellness plans. Our third strategy is to work with our health systems partners to ensure that comprehensive chronic disease screening, referral, and disease management benefits are available and easily accessible through public health plans. Examples of such benefits include community-based lifestyle change programs that address physical activity, such as the Diabetes Prevention Program, Living Well with Chronic Conditions, and Walk with Ease. These programs are evidence-based and can help people become more active and improve their health. We know that more people will take advantage of these programs if their doctor recommends them and if their costs are covered by insurance. As with the strategies in the other goal areas, these strategies are meant to reinforce each other. Encouraging people to be physically active is important, but isn't enough. We also have to make it safe, easy, and convenient for all people to be physically active every day. While we don't have funding specifically for physical activity initiatives, we are usually able to leverage small amounts of funding from our various chronic disease grants to advance these strategies. Last year, through our arthritis program, for example, we were able to collaborate with the Safe Routes to School National Partnership to support 2 Safe Routes to Parks projects that focused on improving access to local parks for older adults. One of these projects was led by the Salem Leadership Foundation and focused on improving access to Woodmanesee Park in South Salem. The Salem Leadership Foundation chose this park because they heard from the residents at many of the nearby assisted living facilities that they couldn't walk to the park because the sidewalks and crosswalks connecting their homes to the park were either unsafe or non-existent. The grant we provided the Leadership Foundation enabled them to engage residents to identify barriers and work with their local transportation, parks, and public works agencies to develop a plan to address the barriers. This effort resulted in the city investing in multiple improvements, including new sidewalks, crosswalks, and curb ramps, along with wayfinding signs in the neighborhood to promote and facilitate park use. On this slide, you can see the before and after pictures for one of the park projects that provided a curb ramp and walkway for accessing the restrooms. We also have a strong partnership with the Oregon Department of Transportation. This partnership has provided us with opportunities to provide input for multiple state-level plans, policies, and programs. As a result, an increasing number of state-level transportation plans, including the Oregon Bicycle and Pedestrian Plan and the recently updated Oregon Public Transportation Plan, contain both health and equity-focused goals and objectives that help prioritize investments in active transportation infrastructure and programs in underserved communities. By including such policies in state-level plans, we also hope to provide a framework and foundation for similar goals to be included in local and regional transportation plans. And with that, I will turn it over to my coworker, Jen, to talk more about our nutrition area.
Thank you very much, Steve. My name is Jen Chandler, and I am a policy specialist here in the Health Promotion Chronic Disease Prevention section. And to get us thinking a little bit more about our food environment, I have a poll question for you. Are snacks, beverages, or free candy regularly available to you and other employees in break rooms or other areas of your workspace? I'll give you a few minutes to answer this question. Thank you. Thank you to all who have participated in the poll. I'm going to go ahead and close it. So it looks like about 2/3 of you do have access to snacks, beverages, or free candy in your workplace. And I'm sure most of us can sympathize with having treats around. Sometimes it's very difficult to say no, even if you're trying to lose weight or even to maintain a healthy weight. It can be really challenging to say no to those treats that are around. And this is just one way we think about supporting a healthy food environment in our workplace. So I'm going to take a little bit of time here to talk to you about our nutrition a priority area. As Steve mentioned, poor nutrition is one of the primary drivers of obesity, which is the #2 preventable cause of death and disability among Oregonians. And poor nutrition can increase the risk of developing severe and lifelong chronic diseases. Karen mentioned earlier something very important that definitely applies to the way that we think about and talk about obesity. Blaming individuals who live with obesity does nothing to improve their health or the health of our communities. In fact, weight bias and stigma can heighten or even create mental health issues. The focus of public health and this strategic plan is on improving our physical and social environments in ways that help all Oregonians maintain a healthy weight and live healthful lives. Our environments have a significant effect on our ability to access healthy foods and make good food choices. They can determine if nutritious options are available to us, how often we are exposed to harmful products, including sugary drinks, and whether or not we will be targeted by excessive advertising and marketing messages that promote unhealthy options. Here you can see our objectives to improve nutrition for people in Oregon. Unfortunately, the state has very sparse funding to improve the food environment. which is why you may notice a strong focus on sugary drinks in the Health Promotion and Chronic Disease Prevention Strategic Plan. Consumption of sugary drinks is a major contributor to the obesity epidemic. Not only does raising the price of sugary drinks reduce consumption, it also offers one way to raise revenue for a needed comprehensive program that includes coalition and partnership support, education and awareness, data and evaluation, community programs, statewide coordination and stewardship, and evidence-based support services for people across the lifespan. The sugary drink industry has targeted marginalized communities for years. As a result, sugary drink consumption is more prevalent among many historically marginalized communities. Raising the price of sugary drinks has the potential to reduce health disparities in communities that are highly targeted by the sugary drink industry. And when resources from price increases go first towards supporting these communities, the benefits are even greater. In addition to addressing sugary beverage consumption, the Health Promotion and Chronic Disease Prevention section works closely with partners across the state to improve access to healthy foods in public places like state work sites, schools, correctional facilities, and hospitals, and works with partners in the healthcare system to ensure that screening, referral, and disease management benefits are available through public health plans. Here are a few specific examples of our nutrition strategies in action. The Health Promotion and Chronic Disease Prevention works closely with several state agencies to think about the foods that are served to people who are in the care of the state, including schools, the Oregon State Hospital, correction facilities, and other public residential care facilities. Healthy Active Oregon is a statewide coalition comprised of partners such as nonprofit organizations, regional health equity coalitions, state and local government, and healthcare providers working together to advocate for funding a comprehensive nutrition and physical activity program to better coordinate efforts statewide. And finally, the Health Promotion and Chronic Disease Prevention staff works with other state agencies to develop and implement strategic worksite wellness initiatives that include promoting tobacco-free living, increasing physical activity, promoting healthy food environments, and supporting employee mental well-being. This is a specific example of how of efforts that span all of the HIPCDIP priority areas. And with that, I'm going to turn it over to Ilana Kurtzig to talk about our fourth and final priority area.
Great, thanks, Jen. So my name is Ilana Kurtzig. I am a policy specialist in the Health Promotion and Chronic Disease Prevention section, and I'm going to take the next few minutes to talk about our goal of reducing tobacco use. So like the other areas, we'll start off with a poll question. So you should see a poll now asking you whether you are exposed or you know someone who is still exposed to secondhand smoke at work. And I'll add that we'll include the aerosols that come from e-cigarettes as well. So do you know someone who is still exposed, or are you yourself still exposed to secondhand smoke at work? So we'll give that a second to come up and see what the responses are. All right, we'll go ahead and close the poll. So we've got, it's pretty close to 50-50. We've got 47% of you who, yes, are still exposed or know someone who is still exposed at work, and 53 no. And I will mention that in the first webinar that we did, that was the exact number as well. So that is still a lot of people who are still exposed to secondhand smoke at work. So we'll talk a little bit about that here in our goal to reduce tobacco use. So why are we looking at tobacco use? So tobacco remains the #1 preventable cause of death in Oregon. It is also the top cause of preventable death in the U.S. and globally. In Oregon, it is responsible for more than 7,000 deaths each year and costs the state more than $2.5 billion each year in medical spending, lost productivity, and early death. So some of the diseases that are tobacco related or as a result of tobacco use include asthma, arthritis, cancers, diabetes, heart disease, and stroke, among other things. Our strategic plan focuses, therefore, on creating those spaces and places for people in Oregon, for all people in Oregon, to have access to environments that support health and that protect us from unhealthy industry influences. So it's a high cost here, and that's a cost to us individually as people, as part of being people in Oregon. We are all people that are important, valuable, and deserve equal access to healthy environments. And so that is why we are focusing on tobacco use as one of our strategies. So we'll dig in now a little bit into the specific objectives. So the objectives to reduce tobacco use, you've seen similar ones in other strategy areas. So we are looking at increasing the price of tobacco products, protecting people from secondhand smoke by strengthening state and local laws, increasing local jurisdiction restrictions on tobacco marketing and promotion, reducing access to tobacco products in retail settings, and decreasing the prevalence of smoking among low-income Oregonians. So what is the rationale for focusing on all of these objectives? So combining these efforts, we are looking to keep youth from ever starting to use tobacco products. So that also includes e-products that I mentioned earlier, so e-cigarettes that deliver nicotine. Secondly, to reduce exposure to tobacco marketing. And third, reducing exposure to secondhand smoke. So a combination of those efforts can make a big difference in decreasing tobacco use. I'll note that we're having trouble advancing the slides, so I'm going to keep going, so you'll hopefully here in a moment see the objectives listed on the screen, but at the moment they're not pulling up, so just want to acknowledge that, but we're kind of plugging right along here. The tobacco industry has spent decades targeting certain people in Oregon and across the country with their harmful products. Some of those groups are the Black community, the American Indian Alaska Native communities, LGBT, youth, lower income adults, and those who are living with mental illness are particularly targeted and have been for decades. As we mentioned earlier in the presentation, and we'll probably, you'll continue to hear this come out of the Health Promotion and Chronic Disease Prevention section. As a result of this targeting, it's created disparate outcomes in health, where much of the burden falls on these different groups. So basically, they have more tobacco-related disease. And that's why our plan directs, again, to these objectives. So increasing the price of tobacco, which reduces use among youth and lower income adults, and help those who have quit stay quit, and then help those who want to quit quit. And directing a portion of the cost increase to prevention only amplifies those efforts. Secondly, protecting people from secondhand smoke exposure. Though we have indoor clean air laws, exposure to secondhand smoke still exists in Oregon and at work for sure, as you demonstrated in answering the poll question. Secondhand smoke is detrimental to health, and environments that are not smoke-free make it, again, tough for people who want to quit to do so and to stay quit. Third, limiting the tobacco industry's influence in the retail environment. So when we say retail environment, stores like convenience stores and other types of retail settings like gas stations and grocery stores. So reducing that industry influence and exposure in these areas really serves to keep youth from starting tobacco and helps those, again, who have quit, stay quit, and those who want to quit, support them in their quitting by reducing the amount of advertising and marketing that they're surrounded with on a daily basis. Most Oregon adults who smoke cigarettes want to quit, and many of them try throughout the year. Again, it's really a lot harder to quit when you can't avoid tobacco products or advertising throughout your daily life. And then fourth, implementing tobacco screening and referral and cessation benefits and health systems to help users quit, and again, supporting all of these objectives through that implementation. So I'll go through a few examples of things that we have done, or tobacco strategies here in action. Here are some images that represent some of those strategies. So on the right, you see the Governor Brown meeting with some students a couple years ago when the age of minimum legal sales age for tobacco purchase was raised to 21. Second, on the bottom is a little snippet from a tobacco retail license from Klamath County. So in Oregon, there is currently no statewide tobacco retail license. So retailers in the state do not need a license to sell tobacco products. Some counties and communities are implementing a tobacco retail license to hold retailers accountable and allow them the privilege for to sell tobacco products. And so Klamath County is one of those communities that has done that. And then third, on the top on the left, providing language-specific resources for those who want to quit and helping people access those resources for cessation. As I mentioned, most Oregon adults who smoke cigarettes want to quit and often need support to do so. So again, all of these examples and the objectives that I mentioned in the previous slide are part of a comprehensive work to decrease tobacco use. So none of these things in and of themselves is going to solve the problem, but in concert, they work to reduce tobacco use. So with that, I'll pass it back to Lucy to wrap us up and have some discussion time.
Great, thank you, Ilana. As Ilana just said, it's now time for discussion and questions. As a reminder, the phone lines will remain on mute. If you have a question that you would like to ask, please use the raise your hand feature and we'll unmute your specific line. And you're also welcome to submit a question through the chat box. And in fact, we did get one through the presentation, and I'm really impressed with this question because, as we mentioned earlier, you'd see some themes across our goal areas, some common threads about how we approach this work, and one of those approaches, of course, included price. The question that came in asked, why is there no increase in beer tax included, and what can we learn from TPEP about that? So excellent question, and to respond, I'll have Amanda speak to that.
Okay. Yeah, that's a great question. I'm sure others may have been thinking the same thing back to our poll question earlier in the slide deck. While there may not be a singular answer to that specific question, there are potentially many factors influencing factors that is the reason why the beer tax has not been raised in over 40 years in Oregon. I think we can think together about the collective awareness around understanding the harms related to alcohol use and excessive alcohol use, and expanding our understanding of those harms, inclusive and beyond substance use disorder and those with alcohol dependence. So really understanding the kind of the harms and costs related to alcohol may not have been widely understood or embraced. We also know that there's a strong industry around many of these products that we are talking about in our strategic plan, alcohol being one of them, tobacco being another, and the sugary beverage industry being another. So we can think about the industry influence and presence and power as it relates to reasons why the alcohol tax has not been raised in over 40 years. And then thirdly, understanding how price can be a public health protection when it comes to the harms related to these products and how powerful that can be. So again, understanding harm related to alcohol, industry influence, and collectively building awareness around price as a public health strategy.
Wonderful. Thank you, Amanda. Great question. Any other questions coming in? Again, you can raise your hand and we'll unmute your line, or you can submit a question through the chat function. And we invite you to ask any questions, or if there's something that you're willing to share about how our plan aligns with your work or strategic plan, or where you might see opportunities to collaborate or lead in any of these efforts. Welcome any questions or feedback. All right, it looks like we've got one question coming in. Christiane, Lane County, you have the line.
I was trying to write my question in, but hi. So I was wondering, is a sugary beverage tax something that the state is interested in pursuing, and is there any momentum at the local level for that policy initiative?
Christiane, thank you for your question. I will direct it to Jennifer Chandler to respond to.
Yes, thank you, Christiane. We do, as Amanda said, raising the price of these harmful products is a protective public health intervention. We have seen not just across the country, but across the globe, that raising the price of sugary beverages can reduce consumption, particularly in communities that are bearing the biggest burden of the harms of sugary beverages. We are currently working with the Healthy Active Oregon Coalition to understand more about how we can help to support and communicate about the harms of sugary beverages and about the benefits associated with raising the price of sugary beverages. So we are actively partnering statewide and really looking at the landscape to see where there might be potential at the local level. It is our primary strategy in our strategic plan.
Great. Thanks, Jen. And thank you, Christiane, for the very good question. Let's see here. Do we have any other questions? Nadia, thanks for your question. You have the line.
Hi, this is Nadia LeMay from Crook County. And I was just wondering, how does your HIPCADIP strategic plan align with, I guess, Oregon Health Authority's plan, and how do you work with those other, I guess, that broader picture?
Nadia, thank you for the question. I'll look to see. Karen, would you like to respond to that one?
Sure, that's a great question and something that we always are working, within our own organization, just as you might within yours, to make sure that we are in alignment and leveraging our opportunities as much as possible. The Oregon Health Authority State Health Improvement Plan definitely is in alignment with what we are looking to do here in the Health Promotion and Chronic Disease Prevention section, where we might be more specific around the disease areas and risk factors. Certainly the Oregon State Health Improvement Plan partnership is really looking at the social determinants of health and how that plays into our health. And of course, this is as we've talked about today, the chronic diseases are directly linked to social determinants of health. So we're participating as much as possible in informing that plan and providing data, resources, and partnerships so that we can work collectively to improve social determinants of health and therefore improve and prevent chronic disease.
Thank you, Karen, and thanks for the question, Nadia. It looks like we have another question that came in. Leanna, thanks for submitting your question. For those of you on the line, it's how is developmental origins of chronic disease being addressed in the plan? Specifically, the understanding that nutrition during pregnancy and early life, lifelong sets chronic disease risk. And to answer that question, Jen Chandler is going to help us with that.
Yes, thank you, Leanna, for that question. And I think it's a great way to illustrate how complementary these two practices are. We absolutely coordinate with partners throughout the state who are focused on the developmental origins of chronic disease, and we offer an opportunity to understand how the environment really can help support nutrition throughout pregnancy, early life, and really across the lifespan by protecting people from harmful industry marketing, really looking at what their availability to healthy food is, whether they're just inundated with unhealthy options. And so we are really excited to continue to partner to make sure that we really are addressing the developmental origins of chronic disease in our work.
Great, Jen, thank you so much, and thank you, Leanna, for the question. It looks like that sums up the number of questions we have, so thank you for offering those up. And with that, in wrapping up our webinar, I want to leave you with a few key takeaways. Our strategic plan establishes our goals, strategies, and objectives for reducing chronic diseases in Oregon. I hope that you'll use this plan as a resource in your work as appropriate, and do continue to have a conversation with us to figure out how there is that alignment and ways that we could possibly work together in the future, because we know that we have in front of us some really important work to be done. We have common goals, and that aligning the way that we approach addressing those goals and getting to outcomes is really important. So please continue to think about that. We'll be here and look forward to continuing the conversation with you. So thank you again for attending the Health Promotion and Chronic Disease Prevention 2017 through 2025 Strategic Plan Share Out. We hope the webinar is informative for your work, and we look forward to collaborating with you as we all do this important work together. Everyone in government, public health, health systems, businesses, and communities have a role to play in improving health in the state, and we call on all Oregonians to seize their roles in this vital endeavor. As a result, Oregon will be a more healthful place to live, work, learn, play, and age for all of us, and I think that's a pretty important goal for us all to contribute together. So thanks again, and we'll look forward to hearing from you. Take care.